Well, colouring on from my eye saga. Do not look if you're squeamish, but it's got worse, not better. I've taken antihistamine. I've had drops. We're now in hospital.
Yes.
I should have probably gone a few hours ago, but I didn't think this was going to happen. I don't understand. I've never seen anything like this. It is actually oozing, and I've got a headache now. This is ridiculous.
This is Caroline Stanberry, a reality TV star and businesswoman who earlier this year shared her experience with a serious eye infection, orbital cellulitis. And while it's rare in adults, I want to talk about it because we do see related conditions in children, and it's something parents should know how to recognize. Hi, I'm Dr. Mona, a pediatrician and mom, and hit that follow button if you're not already, as I help make sense of all things child health, development, and parenting. Let's break this one down. There are two main types of bacterial eye infections involving swelling around the eye: periorbital cellulitis, also called preseptal cellulitis, and orbital cellulitis. Periorbital cellulitis is much more common in kids. It happens when bacteria infect the skin and soft tissue around the eye, usually in front of a barrier called the orbital septum. It can show up after a bug bite, a scratch near the eye, or even a runny nose or sinus congestion that causes local spread. Orbital cellulitis, on the other hand, is deeper. It's behind the septum in the space around the eyeball where the muscles and nerves that control eye movement live. And when that space gets infected, it's a medical emergency. So how do you tell the difference? If your child has periorbital cellulitis, the eyelid may look red, swollen, and puffy. Their eye still moves normally, there's no pain when they move the eye, and vision is not affected. They usually don't have a high fever. If your child has orbital cellulitis, you may see pain with eye movement, limited ability to look up or side to side, bulging of the eye, changes in vision, and sometimes a fever and signs they just don't feel well. So yes, periorbital cellulitis can look scary, but it's usually manageable with oral antibiotics if caught early. But orbital cellulitis, that's ER right away. It may require IV antibiotics, imaging like a CT scan, and close monitoring. And here's the tricky part. Early on, periorbital cellulitis can be mistaken for a bug bite or mild irritation. But if the swelling spreads, doesn't improve in 24 to 48 hours, or if your child suddenly avoids opening or moving their eye, it's time to get evaluated. Behavior can be the clue. Your child might not say, my eye hurts. But if they're suddenly clingy, won't open one eye, or seem extra sensitive to light, that's your sign. So thank you, Caroline, for sharing your story. It's a reminder that eye swelling shouldn't be ignored. And if this was helpful, send it to another parent, because knowing what's normal and what's not can really change the outcome.